So today we're going to show some whitening. Okay, so you should have got some molds taken of your teeth at the original appointment, and this is what they look like. Okay, so we've got some molds of our patient. Okay, from this, our technician has made some whitening trays. Now these are custom whitening trays. So if you look as they go on, you'll have some for the bottom and some for the top. So these ones are for your top and these ones for your bottom. So if you look at how they will go on, they just squeeze on like this, okay? Here, you will have your desensitizing swabs. You'll have your 10%, your week 1-2 gel, and your second gel, which is the strongest 16%, okay? So we're gonna go through all this today. Then, try and suck the air out of the tooth. So make sure that they're dry when you place them in, okay? You go to your fridge, and you'll get, say for example, you're starting with the 10%. You'll unscrew this. You can see it comes off across like this. And then you will screw in the attachment, okay? You then break the top part of the attachment, and it can turn around to become a lid at the same time, like so. You see that? Good, so you take it off, and then it's ready to be applied. So, you'll have your tray gel, and we'll show you here on the contrast. You'll have your tray gel here like this, and we want a pea-sized amount in all the teeth that are shown. Now we don't need to go to the molar, the very back teeth, so these are the very back one. We just need to do the front teeth that are shown at smile. So this one, this one, this one, this one, this one, and to your premolars basically. I would say premolar to premolar. And you want the gel on the aim we want it is inside the crease and just on the front surface. Now you don't necessarily want to whiten the back, but you can do, but we're just going to show you the pea-sized amount, okay? So you put just there, okay? And you do this with all the teeth from premolar to premolar. So in this case we're just showing one teeth just to show you in detail there. Okay, do you see that? Pea-sized amount. And you'll see there's the gel there, okay? Good. So now we're going to place it in the patient just to show you. Gel has spread over this tooth. Now, we want to make sure that there's no excess gel on the gum, okay? So in order to make sure that that's 100% away from the gum, we'll get a cotton wool bud and just wipe it away, okay? Make sure it's away. Okay, so then you'll whiten your teeth for a minimum 2 to 3 hours. We'll always do a session in the chair to make sure you have no allergies or reactions. And then, so presume that we finished. You can see the scallop margin, so make sure that there's no excess. Once you've finished your whitening, you just take the tray out as normal, but start from the back. Start from the back, and then peel it forward, okay? And it will come off just nicely. Okay? Then you'll have some excess gel or whatever on the teeth. So just turn your head to the right. Okay? And you'll get a warm toothbrush and you'll wipe that away and just brush your teeth as normal. Then in the tray gel, you'll have a little bit of excess and just use cold water and brush the excess away with your toothbrush. Okay? We advise you to do the same for the bottom, exactly the same way. Okay? So you'll have your gel trays, and we want to go from premolar all the way around to premolar. You don't need to whiten the very back to molar teeth, okay? And it's exactly the same philosophy, just inside the very edge at the front, okay? And you go through and you put a pea-sized amount. So you wear these both at the same time, okay? Then, as we've described a minute ago, once you've finished and done your whitening, you then put your cap back on, and then you put it in the tray as normal, and you're good to go, okay? Now, these go in your fridge, because what you can see underneath is you've got the cool bag, okay? So make sure it's in a cool, dry place, okay? Now in your packs, you're going to find that there's some Evo desensitizer snap swabs, okay? So I'm going to show you how to use those today. So inside your Evo swab is that you've got these almost like cotton wool buds, okay? And let's take one of them out to show you. So inside the bud, you've got a gel inside this clear tube. I don't know if you can see the liquid. Can you see it? So this is if you've got somewhere particularly sensitive. So for example, on our lovely patient here, if she's got some gum recession or somewhere that's particularly sensitive, just say for example around here, what you do is you squeeze the gel of the tube and you just squeeze it till the fluid starts coming out, okay? And then you apply that sensitivity gel just to the area, okay? My preference is once you've used all of the 10%, then go on to the 16. Now this is stronger, so be aware that you might have some sensitivity as a result. Included, you should receive some, sometimes we give you some whitening toothpaste, so you can use this for slightly whiter toothpaste if you want to ameliorate the results. The second one is really important, like a sensitivity toothpaste such as Sensodyne or tooth serum is really good, okay? So what you can do, if your teeth are really sensitive after whitening, you can, instead of placing whitening gel in the tray, you can just use the sensitivity toothpaste as a sensitivity tray. So instead of putting the whitening gel, you just put your sensitivity toothpaste inside, okay? So the tip is you put some sensitivity toothpaste in your tray and you wear that overnight or however many hours before you whiten, okay?